are three sort of levels at which you can pick up autism. One is something called surveillance, which means that every time a child visits their pediatrician, the pediatrician, even if they aren't a developmental pediatrician, the pediatrician should always ask them questions, so to find out if there's anything the parents are worried about, see the child, examine the child, is there anything that the pediatrician is worried about, and if they are worried about anything, then they should raise concerns at that point. Okay? The other thing is, the next step really is screening, so formal screening. And what that means is that it's set points, and what the American Academy of Pediatrics says is 9 months, 18 months, and 24 to 30 months. That at those three ages, every child, whether they have a problem or not, every child should have a formal developmental screen and a formal autism screen, just to pick up any problems or to pick up any early signs that maybe the parents might not really have. If anything comes up on those screens, then the child should be sent forward for a proper full diagnostic assessment.
I think Dr. Tanya highlighted a very important point, because I think these screening points are essential, especially for early intervention. Now, coming to diagnosis, the best way to diagnose autism is through a multidisciplinary team. The team should include a pediatrician, a developmental pediatrician, a psychologist, a speech and language therapist. The assessment process itself should look at IQ, it should look at, you can use SCARS or the ASQ as a way of assessing symptoms of autism. You should also have or the ADOS, which is a play-based assessment to look at symptoms of autism. There should also be a speech therapist, which has an assessment of the child's level of speech, if any. There should also be a developmental screen to see that is it just autism, or does the child also have other developmental issues. So there has to be a very comprehensive assessment looking at different aspects with different professionals involved.